Coco is taking over the kitchen of Project Angel Heart. This is the Denver headquarters. Project Angel Heart offers medically tailored meals to those living with life-threatening diseases across the metro state. We are so excited to be here with Leslie Scotland Stewart, who's going to be giving us a tour of the facility and telling us a little bit more about this incredible organization and all that we're doing. Leslie, tell me a little bit about how long Project Angel Heart has been impacting lives and creating medically tailored meals for those living with diseases.
Yeah, absolutely. So happy to have you here today. We've been around actually since 1991, so a long-standing local nonprofit here in Denver, and we've been able to serve more and more people over the years.
It's incredible. What you're doing here in the kitchen is fantastic. What kinds of diseases are you catering to?
Absolutely. So mostly people with life-threatening illnesses. So cancer, congestive heart failure, people who really are struggling with their health and need that extra meal to kind of keep them healthy.
Certainly. How long have you been here?
I've been here 3 years.
3 years. Yeah. And what keeps you passionate and excited about the mission that's going on here?
Absolutely. I am really obsessed with getting more nutrition and healthy food into our healthcare system. I had my own health journey. I lost about 40 pounds and saw such a huge difference in my health, so I want to help that happen for other people.
Wonderful. Yeah. We are so excited to learn more about everything happening here at Project Angel Heart in just a few minutes. Colorado and Company starts right now. Thanks so much, Karen. We're at the Denver headquarters, Project Angel Heart. It's the tastiest mission in town. So many great things happening here. I'm joined again by Leslie Scotland Stewart, who is the Director of Healthcare Innovations, to tell us a little bit more about the organization, including this really cool wall that's behind us. This is Royal Crest milk carts that cover the span of this wall. What else is happening here, Leslie? What do we see?
Yeah, absolutely. We moved into this wonderful facility in 2012, and so all of these discs are various donors that actually made it possible for us to build and be in this beautiful facility.
Isn't that great?
Yeah.
And as we walk down, we're going to see a little bit more of the great visual of this wall. This facility is over 30,000 square feet, which then lends itself to a lot of help.
Yes.
You have volunteers that come in weekly, daily, who help make this mission happen.
Yes, we have the most amazing volunteers. We have around 350 people every week that come into our facility and deliver meals and chop up veggies. Some of them have been with us for 20 plus years.
That is incredible. And how many volunteers total?
About 8,000 a year.
8,000 a year.
Yeah.
That's incredible, you guys. This couldn't happen without them. All right, so let's talk about some of the nutrition plan and really when it's tailored for people living with life-threatening diseases. What does that mean and what are those diseases?
Absolutely. So for individuals that have different diseases, like let's take congestive heart failure.
Okay.
An individual that has that disease, they need low salt intake. So when we prepare those meals, we make sure that not too much salt is put into the food. We flavor it in all different ways, and it makes sure and keeps them nice and healthy and stable.
Okay, and then how do you know that these programs and the meal plans are really working for those who are receiving them?
Yeah, absolutely. So our clients have told us for years that it makes them feel better and have more energy. But in addition, we actually did a research study. We showed that individuals that received our meals actually had 24% lower healthcare costs.
That's incredible. Yeah. And I know that you've got healthcare providers that are really jumping on because this is not only an incentive, but it's something that the medical providers want to see their patients doing because it does make a difference when you're suffering from symptoms, right?
Yeah. Well, healthcare has figured out that you can give people all the medicine and different treatments in the world, but unless you address their nutrition, they're still going to struggle with their health. So we have insurance companies, we have state Medicaid plans and Medicare plans that are really evaluating the use of medically tailored meals as part of their treatment for their patients.
Sure. We talked about some of the diseases that you cater to, diabetes being one of them. You have a new program. It's a diabetes pilot program.
Absolutely.
Tell us about that.
So diabetes was not traditionally a diagnosis that we would serve under our main program, but we partnered up with an organization called Telligen who does diabetes self-management education classes. So what we did is we compared people that were receiving those classes for 6 weeks, and then with a second cohort, we gave those individuals meals to see if you had meals, did you do better than somebody that just had the classes? And we definitely saw more improvement in weight and blood pressure, and then overall stress for the people that actually got the meals.
And it's got to make such a difference when you're trying to heal from a life-threatening disease. I know that you're working with the providers like we were talking about, but you're delivering meals over 400,000 a year to folks in the metro area and beyond, Colorado Springs included.
Absolutely.
What an incredible machine that's happening behind these walls.
It is. It is. It's quite a machine. So our production is an art form in itself between preparing all of these made from scratch meals for 1,200 clients per week, to then getting them all across the state. We actually do Denver, Colorado Springs. We actually also ship meals through our healthcare partnerships program. So we cover the entire state of Colorado.
That's incredible.
Yeah.
We're going to be heading into the kitchen to see a meal and see it be put together, bagged up, and ready to go out here shortly. In the meantime, we want you to go on to projectangelheart.org to learn all about what they're doing, how to get involved, how to volunteer for this incredible organization. Welcome back to Colorado & Company. We're live at Project Angel Heart, their Denver headquarters. We're in the kitchen of Project Angel Heart, where it is hustling and bustling. There are volunteers behind me doing so much work to prepare meals and get them packaged and out to their clients. I'm here with registered dietitian Megan Perkins with Project Angel Heart. We're talking about the nutrition it's nutrition that heals. It's food that heals. And you do home-scaled recipes as well as nutrition guides for specific diagnoses, don't you?
Yes, we do, and we have nutrition guides for specific illnesses that we serve, in addition to healthy recipes that we make here in our kitchen that folks can make at home as well.
And again, these are medically tailored recipes so that folks can heal from life-threatening diseases and illnesses. And we have an example of one of the recipes here. What do we have here, Megan?
Here is actually one of our meals. It is a diabetes-friendly meal, but it's also appropriate for our clients that might be living with heart failure. We have whole grains from barley. We have a nice lean protein chicken breast that's topped with a romesco sauce that our chefs lovingly prepared. And then we have a nice side of vegetables, our non-starchy veggies. We have green beans. We oftentimes serve broccoli, maybe zucchini, or serve a variety for our clients.
It looks beautiful, and it's food that heals. Food is actually medicine, and so why is that important, that you're feeding your body the right things when you're going through something like a disease?
Absolutely. So when we are sick, evidence shows us, there are many research studies that tell us that the appropriate nutrition or nutritious foods can actually help reduce people's symptoms, reduce healthcare costs, and just make them feel better overall.
All right, so we were talking about some of the diseases that you do cater to, diabetes being one of them, and you did mention that. Is this a recipe that would be catered to somebody who is suffering from diabetes?
Absolutely. So one of the most important things that somebody with diabetes can do is make sure that they're eating healthy carbohydrates from things like whole grains, like barley or brown rice or whole wheat pasta, which are all things that we use in our kitchen, and then a focus on veggies and lean proteins as well.
What would be some things that folks would start to notice when they start eating the right nutrition?
So someone with diabetes might notice that they're better able to control their blood sugars, that they have improved energy levels, and also that their blood pressure might be improved as well.
I was telling Megan that this is how we're all supposed to be eating. This is what I'm supposed to be serving my children, and no starches and none of those heavy calories and different things like that. There's a stigma that nutritious food cannot be tasty. This is tasty. How do your chefs go the extra mile to make sure that the food tastes fabulous?
We have wonderful chefs here. They actually take a lot of time to saute our veggies with garlic and onion. They add dried herbs, fresh spices, and then also lemon and lime juice, which is a great way to bring out the flavor in low sodium foods without having to add too much salt to it.
Wow, that's a great idea. Make sure that they want to eat it and it tastes good. All right, how many meals are delivered? We were talking about 1,200 clients that you have, but really talk about the scope of how many meals are going out.
Yes, so we deliver 7 meals each week to our clients, and they're delivered frozen so that they can choose what they want to eat that day. So if they feel like eating chicken with barley, they can choose that. If they'd like one of our fish meals, they can choose that as well. So each client gets 7 meals every week.
Okay. Let's talk about the resources for people who just want to eat better, especially when they're going through a life-threatening illness or disease. What are some resources that they have to tap into?
Absolutely. So our website, actually projectangelheart.org, has some wonderful blog posts about how to improve your nutrition and what you're eating. We also have nutrition guides for folks living with specific illnesses, in addition to some of these wonderful home-scaled recipes from our kitchen.
If somebody has been recently diagnosed with a life-threatening illness, how do they know if they qualify for a food program like this?
Absolutely. We have a great client services department that they can contact and ask if they would qualify. They can ask their healthcare provider as well. So their doctor, their dietitian, their social worker if they have one, and they can send an application and we can let them know if they qualify.
Megan, you're a registered dietitian. Why do you choose to work here? What is it about Project Angel Heart that attracts you here?
As a dietitian, it's really special to get to work someplace that's having such a significant impact on people's lives through food.
Right. Well, many times people living with life-threatening illnesses don't have the means, energy, or time to eat medically tailored diets. And so at Project Angel Heart, they believe that what you eat plays a huge role in how you manage symptoms and treat diseases. Food is medicine. Professional chefs and dietitians create delicious meals, and loving volunteers package and deliver these meals free of charge to neighbors in need. You can get involved, donate, volunteer, or even get more information at projectangelheart.org. Thanks so much, Megan. We appreciate it. All right, we're going to go back to the studio to wrap up this show.